Let's dive into a topic that a lot of people with ADHD are affected by, but nobody really knows exists. It's something that very, very few people that I've talked to actually know exists. I'm Dr. Jeff Cumro, and over the past 15 years, I've had the pleasure of working with thousands of people, helping them optimize their health. And really, what we do is we work to optimize our brain function. And what we can basically bring the right types of brain function to whatever situation it is. It doesn't matter if we have a learning disorder, it doesn't matter if we have autoimmunity, it doesn't matter if you're trying to prevent Alzheimer's, whatever. If you can bring the right brain function, if you can optimize that brain function, then your health is going to be better long term. So that's ultimately what we do. And like I said, I get to talk to a lot of people that have a lot of different conditions, whether it be ADHD or autoimmunity or whatever else it may be. And one of the questions I always like to ask people with ADHD is, what type of ADHD do you have? And most people just give me the blank stare and they're like, it's ADHD, right? They don't have any typing of this. Now, there is some neuropsychological testing that can be done to give you what type, to basically figure out, do you have type 1, do you have type 2, type 3. Now, what are the types? Type 1 is more of the inattentive type. In type 1, we see more right brain dominance, and it's just easily distracted, right? They can't focus on what they want to focus on or need to focus on to get the successful outcome that they need to. Type 2 is more hyperactive. These are the kids that are pretty easily identified, right? They're bouncing off the walls and different things like that. It's more of a left brain dominancy. They're constantly in motion because of that left brain, just constantly driving that output, that motion. And then type 3 is combined, and that is, again, a left brain dominant output. You get the hyperactivity as well as the inattention, and obviously that can lead to some difficulties in academic situations or really any situation that requires them to sit down and focus on anything. So it's important to know your type. Why is it important to know your type? Let's look at a knee issue to start with. So if you have a torn meniscus and they decide that you need to go in and have your ACL repaired and that's going to fix your meniscus, is that going to work? No is the right answer, right? Unless you have an actual issue with that ACL or that meniscus, whichever one you're going in to fix, you're not going to get the right answer unless you go in and actually work on that one. You could still have a knee surgery, but unless you go in and you have the knee surgery on the specific part that is injured, it's not going to help you out. And that's what we see so often in ADHD is, people bouncing around on different treatments, trying to figure out what is going to be the right way for them. We see a lot of people that even when they are treated, they don't get the output that they want. They don't get the outcome. They don't get that successful, ultimately, they don't get the result that they're looking for is ultimately what I'm trying to say. And a lot of this comes back to, if we actually look at the typing, if we take the time and do the neuropsychological testing, and a lot of this testing should be available through your school system, but if we take the time and actually do that, then we know what type you have, and we should have a better idea of what is going to fix it. Why? Especially with what we do, we should have a better odds of actually fixing it. Because when we know, are you right brain dominant, are you left brain dominant, it gives us better ideas. Now, there are a lot of different things that go into this. So when you look at things and you're like, okay, I'm right brain dominant because I'm creative. You may or you may not be. I'm left brain because I'm analytic. You may or may not be. There's a lot of different types of brain function that we need to look at to get a full picture of what's going on. So we're not just going to look at one function and say, that right there, it determines that you're right brain, it determines that you're left brain, because it doesn't work that way. We've got to look and see how are most of your pathways firing. And when we can do that, the treatment is ultimately going to be given to us by what areas are not functioning, what functions are you not able to do. And when we can look at that and put together a plan, then you get better outcomes. Now, why does this work better than other types of treatment? When we look at gold standard treatments are what's considered the best based on a long-term research that we have, right? So gold standard treatments can be great in a lot of ways, but there are a lot of ways that they hold us back too. There are some gold standard treatments that are only like 18% effective. that in my mind is not a gold standard treatment. If you're getting 1 out of 5 people better, is that really gold standard treatment? It's not, right? A lot of the medications that we use are used off-label, so they're not actually designed to, or they're not actually being used in the way that they were approved to be designed, or approved to be used. So there's a lot of things that go into this that kind of leave you scratching your head a little bit, right? When you dive into this, it's something that is not as straightforward as what you might expect. Now, why is this not the gold standard treatment? A lot of the stuff that we do, where we look at the brain function and we work to stimulate that underlying brain function to bring balance into the system, whether something is overfiring, calming that down, or if something's underfiring, bringing that up. But when we have that balance between the two sides, doesn't matter what type of environment we're placed in, we can easily get the right type of output just by controlling the levers however we need to get that output, right? Why is this not the gold standard treatment? It hasn't been around as long, so there's not as much research behind it. And the other problem with this, a lot of things that make something a gold standard treatment is, if you have this, you take this, right? So if you have ADHD, you take methylphenidate. It's laid out for you. This is not like that, because everybody's pathways are different in this. Multiple type 1 ADHD people are going to have different types of networks. Some of them might have issues with eye movement. Some of them might have issues with their vestibular system. Others might have issues with just the cognitive speed and timing of everything. So it's hard to just take one person and just use one treatment and get the outcome that you're going to get. We've got to look at it. We've got to design a system specifically for you. That's ultimately the reason that this is not the gold standard treatment, is we can't just take one person and institute this. Now, you're seeing a lot of research that is coming out where they are taking, these autistic populations are doing this type of exercise, and they are getting significant improvement in that. So there is a lot of research behind this stuff, but it's not considered the gold standard because it doesn't have years and years of research where we take one thing and we institute one action. We've got to customize that action to get you the best results. That's ultimately where success lies. Even when you're looking at a gold standard treatment, a lot of times your therapy is customized, right? Because they will try it. If it doesn't work, they try something else. If that doesn't work, they try something else. And there's still a lot of the population that's being left behind because none of those things work, right? So ultimately, that is the thing I want to challenge you to do, is find out what type of ADHD you have, because it is important to know. And like I said, I've met maybe 1 or 2 people that actually know what type of ADHD they have, and this testing should be available through your school system. You may have to push for it a little bit, but it should be available through your school system, and it gives you the information that you need to take that next step forward and get the right treatment. And when you get the right treatment, that's where success lies, right? It doesn't matter what somebody else needs, it matters what you need. So figure out what type you have, dive into the right treatment, get the success you need to have. I hope that you find this helpful. I know that this is kind of an in-depth topic, so if you do have any questions, please reach out to me. As always, I greatly appreciate your time and attention. I know those are your greatest resources, and I appreciate you spending some of that with me. I will look forward to catching you on the next video. Have a great week.